Right now, while you're sitting there feeling perfectly fine, your blood sugar could be spiking to dangerous levels, and you would never know it. No dizziness, no sweating, no warning signs at all. That's what makes this one of the most underestimated health threats for people over 50. Most people think diabetes is something you either have or don't have. You get a number from your doctor, maybe a prescription, and you go on with your life. But here's what almost nobody tells you. It's not your average blood sugar that's destroying your blood vessels, your kidneys, your eyes, and your nerves over time. It's the spikes, the sharp, sudden surges that happen after meals, and that can occur even in people who are told their A1C is borderline or pretty good. A single after-meal spike can cause inflammation in the lining of your blood vessels that lasts for hours. If this happens 2, 3, 4 times a day, every single day, for years, that's thousands of tiny injuries to your circulatory system. And conventional checkups often miss it completely, because a routine blood draw usually happens in a fasting state, when your blood sugar looks its calmest. I've reviewed countless glucose monitoring logs from patients who were told their numbers were fine. And yet, their post-meal readings were spiking well above safe ranges, day after day, for years, without anyone flagging it. Here's the part that surprises people the most. Many of the everyday habits we're told are healthy. Fruit smoothies, whole wheat toast, even some diabetic-friendly snacks can trigger some of the sharpest spikes of all. It's not always the obvious culprits like candy or soda. Sometimes it's the breakfast you've eaten every single day for the last 20 years. By the end of this video, you're going to understand exactly what causes these hidden spikes, what's actually happening inside your body when they occur, and, most importantly, the specific practical changes that can help you bring your blood sugar into a safer, more stable range, often faster than you'd expect. We'll also talk honestly about what's realistic, what isn't, and why working closely with your own doctor through this process matters more than ever. So if you've ever felt like you're doing everything right, but your numbers still aren't where they should be, stay with me. What you're about to learn could change the way you think about every meal you eat for the rest of your life. Before we go any further, let me take a moment to introduce myself, because I think it matters who you're getting this information from. My name is Dr. Ryan Montel. I've spent over 15 years working in clinical medicine, including time in internal medicine wards where I saw, week after week, the long-term complications of poorly managed blood sugar. Things like nerve damage in the feet, vision changes, and cardiovascular issues that had been quietly building for years before anyone caught them. In my practice, I've worked with hundreds of patients over 50 who were managing prediabetes or type 2 diabetes. And I spent a lot of time looking not just at lab numbers, but at what's actually happening day to day, meal to meal. Now, before I'm accused of being anti-doctor, I am a doctor, and I deeply respect the medical system. Routine care, medications, and regular monitoring save lives every single day. And nothing I say in this video should ever be a reason to stop or change a prescribed medication without talking to your physician first. But here's the honest truth about how the system is often structured. A typical appointment is short, focused on a handful of lab values, and rarely has time to dig into the meal-by-meal patterns that drive long-term complications. According to data from the CDC, more than 38 million Americans have diabetes, and an estimated 1 in 5 of them don't know it. On top of that, over 96 million American adults, more than a third, have prediabetes, and the vast majority are unaware. That's not a small gap. That's a massive, largely invisible population walking around with blood sugar patterns that are quietly causing damage. Part of the issue is that conventional care is built to treat numbers once they cross a clear threshold, and to manage symptoms once they appear. It's not always designed to help you understand and address what's happening in the hours after you eat, which is where so much of the damage actually accumulates. That's the gap I want to help close with this video, not by replacing your medical care, but by giving you the kind of practical, meal-level understanding that can work alongside it. Because when you understand what's actually happening inside your body after a meal, you gain the ability to make small adjustments that can have an outsized impact on your long-term health. In the next section, we're going to go inside the body and look at exactly what happens step by step when blood sugar spikes. And why this particular mechanism matters so much for people over 50. But first, if this is your first time here, I'd genuinely love to know a little about you. Drop a comment below and tell me your age and where you're watching from. And if you're new to the channel, please consider subscribing and tapping that like button. It genuinely helps this kind of information reach more people in their 50s, 60s, and 70s who need it just as much as you do. To understand why blood sugar spikes matter so much, let's take a step back and look at what's actually happening inside your body. Because once you see this clearly, the rest of this video will make a lot more sense. Think of your bloodstream as a busy highway and glucose molecules as cars. Normally, after you eat, glucose enters that highway gradually, and your pancreas releases insulin. Think of insulin as a fleet of tow trucks that guide those glucose cars off the highway and into your muscle, liver, and fat cells, where they're stored or used for energy. In a healthy system, this process is smooth. Glucose rises gently, insulin responds promptly, and within a couple of hours, everything settles back down. Now, here's where it gets interesting. As we get older, and especially after years of certain dietary patterns, our cells can become less responsive to insulin signal, a condition called insulin resistance. Using our highway analogy, it's as if the tow trucks are still arriving, but the car's doors are jammed shut. The tow trucks can't do their job efficiently, so glucose keeps circulating in the bloodstream longer than it should. That's your spike. In response, the pancreas often compensates by producing even more insulin, working overtime to try to force those glucose cars off the road. Over time, this constant overproduction can exhaust the insulin-producing cells in the pancreas, called beta cells. This is a key part of how prediabetes can progress toward type 2 diabetes, not as a sudden switch, but as a gradual wearing down process that can take years. Meanwhile, those repeated spikes have a direct physical effect on your blood vessels. High glucose levels in the blood trigger a process called glycation, where sugar molecules attach to proteins in your blood vessel walls, making them stiffer and more prone to damage. This is part of why long-term high blood sugar is linked to increased risk of heart disease, kidney issues, vision changes, and reduced circulation to the feet and hands, areas with very small blood vessels that are especially vulnerable. Here's the encouraging part. This entire system is remarkably responsive to change. Insulin sensitivity, how well those tow trucks can do their job, can improve, often within weeks, in response to changes in diet composition, meal timing, physical activity, and sleep. This is why some people, working closely with their doctors, are able to significantly improve their blood sugar control and, in some cases of type 2 diabetes, achieve what's medically known as remission, meaning blood sugar stays in a normal range without medication, though this varies a great deal from person to person and isn't achievable or appropriate for everyone. Let me tell you about a patient I'll call Linda. Linda was 63 years old when she first came to see me, recently retired and active. She walked her dog every morning and prided herself on eating what she called a pretty healthy diet. Her annual checkup showed an A1C of 6.2%, which placed her in the prediabetes range. Her doctor had mentioned it briefly, told her to watch her sugar intake, and that was about it. A few months later, Linda started noticing something odd. Around 2 or 3 in the afternoon, almost every day, she'd suddenly feel an intense wave of fatigue, sometimes so strong she'd need to lie down. She also noticed she was waking up at night more often, and small cuts on her hands seemed to take longer to heal than they used to. None of these symptoms seemed connected to each other, and none seemed serious enough to mention at an appointment. When Linda came to see me, we talked through her typical day in detail, and it was her breakfast that stood out. Most mornings, she had a bowl of healthy granola with low-fat milk and a glass of orange juice. On paper, that sounds like a reasonable choice. But when we used a continuous glucose monitor, a small sensor that tracks blood sugar throughout the day, we discovered that this breakfast was sending her blood sugar from around 95 to over 200 within about 45 minutes, and then crashing back down sharply a couple of hours later. That afternoon crash lined up almost exactly with her bouts of fatigue. We didn't change Linda's medications. She wasn't on any at that point. But we made targeted adjustments to how she structured her meals, rearranging the order in which she ate her food, adjusting the composition of her breakfast to include more protein and fiber, and incorporating a short walk after meals, which we'll talk about in detail later in this video. Within about 3 weeks, Linda's continuous glucose monitor showed a dramatically different pattern. Her post-breakfast spikes had dropped by roughly 60%, and the sharp afternoon crashes had essentially disappeared. Her afternoon fatigue resolved within the first 2 weeks. At her follow-up 3 months later, her A1C had dropped from 6.2% to 5.7%, moving her out of the prediabetes range and into a normal result, something her physician confirmed and continued to monitor closely. I want to be clear. Linda's results don't mean everyone will see the exact same numbers or in the same time frame. Every person's situation, health history, and medications are different, and any changes should be made in partnership with your own doctor. But Linda's story illustrates something important: small, specific, evidence-based adjustments, guided by real data about what's happening in your body, can sometimes produce changes that feel almost immediate. Now let's talk about the mistakes, because in my experience, these are some of the most common reasons people feel like they're doing everything right, but their blood sugar numbers just won't budge. Mistake 1: focusing only on sugar and ignoring refined carbohydrates. Many people cut out desserts and soda, which is great, but they don't realize that white bread, white rice, and many breakfast cereals can spike blood sugar just as much, sometimes more, than a small piece of cake. Your body breaks these refined starches down into glucose very quickly, often faster than you'd expect. Mistake 2: eating fruit or carbohydrates on an empty stomach, first thing in the morning. This is one I see constantly. After 7 to 8 hours of fasting overnight, your body is primed to absorb glucose quickly, starting the day with juice, fruit, or cereal. Without any protein, fat, or fiber alongside it, often produces the sharpest spike of the entire day, even if that same food eaten later after other food would have a much gentler effect. Mistake 3: sitting down immediately after eating. This sounds almost too simple to matter, but it makes a measurable difference. When your muscles are active, they pull glucose out of your bloodstream directly without even needing as much insulin. Sitting on the couch right after a meal means that glucose has nowhere to go but to circulate at higher levels for longer. Mistake 4: relying on a single annual A1C test as the full picture. An A1C gives you an average of your blood sugar over roughly 3 months, but an average can hide a lot. Someone could have a good average A1C while still experiencing several significant spikes every single day. It's a bit like judging how rough a flight was by looking only at the average altitude. It tells you very little about the turbulence along the way. I want to be really clear here. These aren't mistakes because people are careless or uninformed. They're mistakes because this information simply isn't communicated clearly in most healthcare settings. I've met retired engineers, former nurses, incredibly health-conscious people, all making one or more of these same patterns, simply because nobody had ever walked them through it this way. The good news is that once you can see these patterns clearly, the fixes tend to be small adjustments rather than complete overhauls of your life. You don't necessarily need to give up the foods you love. Often, it's more about the order, timing, and combination in which you eat them, alongside movement and a few other factors. This is the part of the video where I want to walk you through what I call the steady glucose method. A simple, structured approach built around 5 practical steps. None of these require special equipment, expensive supplements, or dramatic lifestyle changes. And again, if you're on any medication for blood sugar, please talk to your doctor before making changes, since some of these adjustments can affect how your medication works, and your dosing may need to be reviewed. Step 1: reorder your meal. Don't just reduce it. Whenever possible, eat vegetables and protein first, and save starchy or sugary components, bread, rice, fruit, dessert, for last. Studies using continuous glucose monitors have shown this simple reordering can reduce post-meal glucose spikes by 20 to 30%. because the fiber and protein slow down how quickly the carbohydrates that follow are absorbed. Step 2. Never eat carbohydrates completely alone, especially in the morning. Pair any starchy or sugary food with a source of protein, fat, or fiber. For example, if you're having toast, add eggs or a spoonful of nut butter alongside it. This single change addresses mistake number 2 from the last section directly, and it's often the easiest one for people to adopt. Step 3. Take a 10 to 15-minute walk within 30 minutes after your largest meal of the day. This doesn't need to be intense. A gentle walk around the block or even around your house is enough. As we discussed earlier, active muscles pull glucose from the bloodstream directly. In several studies, a short post-meal walk reduced glucose spikes by roughly 20% compared to sitting. Step 4. Consider a continuous glucose monitor for 2 to 4 weeks, if your doctor agrees it's appropriate. These small wearable sensors, now widely available, give you a window into your real, individual patterns, which foods spike you and which don't. Everyone's body responds a little differently, and this kind of personalized data can be far more useful than general guidelines alone. Step 5. Prioritize consistent sleep and stress management. This one surprises people, but poor sleep and high stress both raise cortisol, a hormone that can directly increase blood sugar levels and worsen insulin resistance, independent of what you eat. Even small improvements, like a consistent bedtime or 10 minutes of breathing exercises before bed, can have a measurable effect over a few weeks. I want to emphasize, this method is designed to work alongside your existing medical care, not replace it. For some people with prediabetes, consistent use of these steps, combined with their doctor's guidance, has been associated with meaningful improvements in blood sugar control over a period of weeks to months. For people with type 2 diabetes who are on medication, these same steps can often support better control, but medication adjustments should always be made by your physician based on your actual numbers over time. So, what can you realistically expect, and when? Let's break it down in a way that's grounded and honest, because I think realistic expectations are part of what makes a plan sustainable. Weeks 1 to 2. This is often the adjustment period. Some people notice changes in energy levels relatively quickly, particularly if afternoon energy crashes were a problem, like in Linda's case. Others notice very little at first, and that's completely normal. Your body is adjusting to new meal patterns and timing. And for some people, especially those used to very high carbohydrate breakfasts, there can be a short adjustment period that may include mild headaches or hunger as your body shifts its patterns. This is typically temporary and tends to resolve within a few days. Weeks 3 to 6. For many people, this is where more noticeable changes start to appear. Improved energy stability throughout the day, sometimes better sleep. And for those using a continuous glucose monitor, visibly flatter post-meal curves. If you're tracking your fasting glucose at home, some people begin to see gradual downward trends in this window, though week-to-week numbers can fluctuate for many reasons, including stress, illness, or hormonal changes. So it's the overall trend over weeks that matters, not any single day. Months 2 to 3. This is typically when a follow-up A1C test becomes meaningful, since A1C reflects roughly a 3-month average. This is the point where, working with your doctor, you may see whether your overall blood sugar control has shifted, and where any medication adjustments, if needed, are usually considered. Let me share a second story to illustrate this. I had a patient named Robert, 71 years old, who had been managing type 2 diabetes with metformin for about 8 years. His A1C had been stable around 7.4% for several years. Not dangerously high, but not at his goal either. Robert adopted the steady glucose method alongside his existing medication, with his doctor's awareness throughout. Over 4 months, his A1C dropped to 6.8%. Just as importantly, Robert told me that for the first time in years, he didn't feel that heavy, sluggish feeling after lunch that he'd come to think of as just getting older. I should mention, not everyone sees results this clearly, and some people see slower or smaller changes, particularly depending on how long someone has had elevated blood sugar, other health conditions, and genetics. That's normal, and it's not a sign that something isn't working. It often just means the timeline is a bit longer. The most reliable indicators that things are moving in the right direction include more stable energy throughout the day, fewer afternoon crashes, improved sleep quality, and, over a period of months, with your doctor's monitoring, gradual improvements in A1C and fasting glucose readings. We've covered a lot of ground in this video, so let's bring it all together. Here's what I want you to take away. First, blood sugar spikes, not just your average levels, are a major, often invisible driver of long-term health complications, and they can occur even in people whose lab results look fine on paper. Second, these spikes happen because of a mechanism called insulin resistance, where your cells become less responsive to insulin over time. But this process can often be influenced through specific targeted changes. Third, some of the most common mistakes, eating carbs alone in the morning, sitting immediately after meals, and relying only on an annual A1C, are incredibly common, even among health-conscious people, and they're easy to address once you know about them. Fourth, the steady glucose method. Reordering meals, pairing carbohydrates with protein or fiber, walking after meals, considering a glucose monitor, and prioritizing sleep is a structured, practical way to apply this knowledge in real life. And fifth, realistic change tends to unfold over weeks to months, not overnight. And working closely with your doctor throughout this process is what makes it both safe and sustainable. So here's the one simple thing I want you to do. Starting with your very next meal, tonight or tomorrow morning, try the reordering step. Eat your vegetables and protein first, and save any bread, rice, or sweet items for last. That's it. No special shopping list, no new equipment, just change in order. It's a small thing, but it's a real evidence-based starting point, and it's something almost anyone can try immediately. I'd also love to hear from you. Type the word steady in the comments if you're going to try the meal reordering step starting with your next meal. And if this is your first time here, please consider subscribing and tapping the like button. It genuinely helps videos like this reach other people in their 50s, 60s, and 70s who are navigating the exact same questions. Now, for the important part. Everything discussed in this video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician before making any changes to your diet, exercise routine, or medications, especially if you have diabetes, prediabetes, or any other medical condition. Never stop or adjust a prescribed medication without your doctor's guidance. Managing your blood sugar isn't about perfection, and it's never too late to start. Every meal is a new opportunity to make one small, informed choice, and over time, those small choices add up to real, meaningful change. Take care of yourselves, and I'll see you in the next video.